Hello, everyone. Happy morning and a very happy Youth Day to all our young friends, our brothers and sisters as well. On this very auspicious Youth Day occasion, I'd like to emphasize on a very important factor which really perturbs our National Youth Day. That is the increasing trend of prevalence of cardiovascular as well as cerebrovascular accidents among us. Now, all these sorts of events are due to one cause that is known as atherogenesis or atherosclerosis. Sclerosis term can be used for the older age people, so I used to better prefer atherogenesis as a term, accounting to all such sort of accidents in us. Now, there are two groups of risk factors. One is the modifiable risk factors, the second is the non modifiable risk factors. Non modifiable risk factors is something which we can't help. Like, I mean to say, they are in our blood, our age, our gender, our genetic predisposition, family history. These are something which we can't control. There are also environmental factors as well that also we can't keep under control. So what remains is in our hands is the fraction of the modifiable risk factors which play a more important key role in causing atherogenesis or in causing those kind of CVA or cerebrovascular or cardiovascular accidents as well. Among the modifiable risk factors, first of all, I'd like to emphasize on smoking. Smoking is nowadays very common in females also. Smoking is something which increases the risk of atherogenesis in a more dose dependent manner. I mean to say that the more you smoke, the number of packs you smoke, and the number of years of smoking, that affects. Again, alcohol consumption, a hand to hand risk factor with smoking. In females, there's a preponderance of consuming OCPs nowadays, not only due to voluntary efforts as well, but also due to treatment of some important female hormonal abnormalities, which are now again common due to increase in the same modifiable risk factors which we encounter nowadays. In gynecological practice, almost in every three or four women in a young age, one or two suffer from PCOS, polycystic ovarian syndrome, or from endometriosis. Now, treatment of these diseases on a long term basis require oral contraceptive in consumption. That consumption of oral contraceptives will again cause a disruption in the hormonal balance. Changing in the estrogen progesterone ratio will lead to further acceleration of the atherogenesis process. What I mean by this term, which I am repeatedly using, atherogenesis, is that there is formation of a plaque, a lipid plaque in our blood carrying channels of our body, especially those that supply the heart musculature and the brain as well. Those accumulation of plaques inside causes hypertension. Due to hypertension, blood tries to push inside the plaque. That leads to rupture of the plaque. There's formation of platelet fibrin clot emboli, and that emboli gets dislodged from the primary site of formation to the secondary arteries and ultimately occlude them. The brain or the heart musculature lacks its normal oxygen supply, and there is always a demand on those musculatures, and ultimately, due to a demand supply mismatch, there is something which we usually commonly call a stroke that occurs. In this youth day, my main motto will be to save our youth, to preserve the youth, because that is the actual age group of our country, the actual part of the age pyramid of our country that increases the productivity, that increases the economic balance of our country, that helps to maintain the ecosystem of our country as well. So I request all my young friends to practice at least 5 days a week of getting out from the normal sedentary lifestyles, to have a mindset to increase the obesity, to bring down the BMI to normal, to increase the metabolic activity, perform exercises, avoid taking junk foods, decrease time on mobile reels and videos, and focus more on exercise, a healthy lifestyle, healthy food balance, and all other practices that can lead to a better quality of life with a good quality sleep time, factors which would decrease the stress, any other kind of meditation, breathing exercises, everything that is possible that remains in our hands. That will be my request to all our young friends for today. Thank you.